Welcome into Anchor Talk Psychology. My name is David Kapolis, and I'm a licensed therapist living with bipolar disorder. And I discuss and cover all things psychology related. For this, I just wanted to kind of keep it short and sweet. A question that has come up. Funnily enough, I was out at a restaurant, and kind of like you do as you do when you're sitting at a bar. My wife was there next to me, and someone was asking what I do for a living, and I told them I'm a psychotherapist, and they asked me the question, well, how do you know you're getting good therapy? How do you know you're getting good care? And I was like, that's actually a really, really good question, and it's a complicated one, but I can give you some bullet points here as to try to attempt to answer that in short form. So the first thing, I always recommend that people do consultations with therapists before starting out new. Not every therapist will do this. I do consultations for all of my new intakes. And the reason why you do that is because, number one, you want to make sure that, you as a therapist, you have the training and expertise that the other person might be needing and looking for. Also, what fits them stylistically. Most of my patients are very solutions focused, very active, very involved. There's a lot of quote unquote homework and things to do. That doesn't work for a lot of other people. Other people are looking for more of a sounding board type thing. But I will say there are some commonalities and universal things that stand out to me when asked, how do I know if I'm getting good therapy? Well, first I'll say, this is what bad therapy looks like. Bad therapy looks like you not connecting with the other person and you don't feel comfortable. And not necessarily right away, but after several sessions, if you feel like you can't be yourself and you're putting on airs and it just feels inauthentic, that's a good sign that it's a bad fit. The next one is, it's very important, is that you feel a vibe with your therapist. This sounds a little strange, but what I tell all of my patients is, if you couldn't imagine sitting down at a high top at a sports bar or something, or in some social setting and having a fluid, regular conversation with me, we're probably not going to work out. The next thing is, if you feel like your therapist is being inauthentic, which is, in my eyes, it's an epidemic. Some psychotherapists put on a veneer, they kind of do the whole Himalayan rock, and then the water, running water, they do some infusers, and that's cool, but I feel like in many ways sometimes it's forced, right? And some therapists aren't themselves. They just kind of keep themselves a little too disconnected from their patients. Another thing to look out for also is feeling like when you're looking for feedback, you're not quite getting it, right? And this is something that's brought up to me quite a bit. Some therapist roles, depending on their modality that they use, they might be a little bit more passive, right? So they'll be more of a sounding board. But the key to all of this is, there are two main prongs that you really want to be looking at when you are asking yourself the question, am I getting good psychotherapy? One prong is, it comes about when your therapist is meeting you where you're at in the moment, right? At any given time, and is reflecting back to you and connecting with you, and you feel heard and understood, right? That's sort of the sounding board piece. That's very, very important, obviously, to get from a therapist. However, if you're only getting that, it's a problem, because you could go blue in the face and talk about issues, right? But if you're not getting some education or some tools or something that to take away from the therapy, then it's there. In my eyes, it's a disservice. That's what I call the sounding board therapist. Then, on the other hand, you have the other extreme where you have solutions-focused therapists who are solely focused on finding simple solutions, or making it all about the treatment modality, whether that's cognitive behavioral, dialectical behavioral, or actual solutions focused therapy. So that's the other end. So if you have that extreme, then that's not good therapy. So what you really want is a blend of the two, where you have a sounding board and someone's listening to you, and then on the other hand, you have someone who's giving you something, they're teaching you something. For many of my patients, I have them work through these modular workbooks, and we discuss. I will email them a form that I want them to fill out throughout the week, or we'll do a sleep diary or a mood log, or just something that's going to help glean some information, right? And it's an active therapy is supposed to be very active when it's done right? Not imbalance, not only action, but essentially for all of my patients, I have it set up so that on this hand, I have some work for us to do in session, something in mind, right? Based on our other sessions. However, if you come into the therapy session and you need to discuss something, that's going to be put on the shelf. The plan is going to be put on the shelf for that moment. And I'm going to meet you where you're at. So the question would be better asked, how do I know if I'm getting bad therapy? And I can't tell you how many of my patients have told me I've had a really bad experience, and some of them have even fairly traumatized from it. But that's some other key points I wanted to just kind of lay out there. And believe it or not, I'm actually writing a book about this exact same topic. I'm hoping to have that done in a few months anyway. That covers all different topics and the name of the book is going to be How to Get the Most Out of Therapy. But anyways, put some comments down and let's get a back and forth going about this. I would love to hear your thoughts. All right, so this is David Kapolis with Anchor Talk Psychology. Thanks.